Hey folks, I'm Sevtap Savaş and this is our conversation. Today I'm walking on the streets of St. John's, Newfoundland and Labrador again. You can see the sky is quite mad. It's like it is heavy with a lot of rain. There's a lot of small clouds I see, but usually dark. It's okay. It has something to say to us and we shall see it. But you know what? 14 years in Newfoundland and Labrador, I learned one thing. This weather can change anytime. So maybe at the end of this clip, we will have a clear blue sky. Who knows? Anyways, today, I want to continue our conversation about cancer. You know, our aim is to talk about it, learn from each other, so that we can remove its status from being the elephant in the room to a common public knowledge, because knowledge is power. So far, we have talked about how common cancer was in Canada. We know that around 43% of Canadians are expected to be diagnosed with cancer. We also know that it's the leading cause of death in Canada. Around 1 in 4 Canadians will die because of cancer. Now, these are significant numbers. And when we look at the cancer numbers across the Canadian provinces, we also noted that the highest cancer incidence and mortality rates are detected or reported from Newfoundland and Labrador. So what does this mean? That means residents of this province, residents of Newfoundland and Labrador, have a slightly higher risk of developing cancer and dying from cancer compared to other residents of the Canadian provinces. So whenever we talk about this fact, I always get the same question. Why? What's wrong with us? What's wrong with our province? I'll tell you, we don't know for sure. But we know very established cancer risk factors. And some of them we can detect here as well. So what are they? The number one risk factor is actually age, generally speaking. As we age, our chance of accumulating abnormalities in our cells and DNA increases, so that increases the chance of developing cancer. And you probably remember that Newfoundland and Labrador has an aging population, so this might be one of the reasons. The other reason for the slightly higher chance of developing cancer in Newfoundland and Labrador might be related to social determinants of health. You know, I was very excited, like many of you, when I heard about the annual health accord and its emphasis on the social determinants of health. So I hope that it's just not going to stay like a report, but it will be implemented, because we know that healthy lifestyle, including healthy food and other environmental conditions such as maybe safe housing as well, are related to adverse life events. This also includes cancer. Cancer dieting is, in many cases, is very well established. So, but if you do not have the means to, provide healthy food to yourself, or, other healthy lifestyle factors, interventions you can get, maybe this might be affecting our risk, right? So this is another thing to think about: social determinants of health, sociodemographics. And then, of course, I always examine my privilege. I'm here in St. John's. I'm very privileged because I have access to healthcare centers, hospitals, when compared to, other residents living in the rural and remote areas of Newfoundland and Labrador. So I know in a lot of places our healthcare system overall is in crisis. I think that's a very clear point. But some regional parts like rural, remote areas, Labrador, they have even worse, I think, access to adequate healthcare services. So this may also be a factor. You know why? Especially in cancer and access to cancer screening services. So again, I'm privileged, like many of us living in St. John's. But I keep thinking about other folks living in other areas, whether they have access to these services. I also think whether they have access to knowledge about the services. So, there's something that we come to observe very frequently that even the services support is there, especially by the wonderful provincial cancer care program. Oftentimes residents are not aware of it or cannot access them, the information. So access to information in terms of how to prevent cancer, how to know what are risks and what to do with those, and cancer screening services. And if we ever get diagnosed with cancer, what are the services and supports available to us and our families through charity organizations, including the Cancer Care Foundation as well as the Provincial Cancer Care Program. So these are important. So accessing information about services and support and access to these services. So, and again, I don't know why we have the highest risk of developing cancer in Newfoundland and Labrador, but I try to summarize maybe three reasons that may explain at least a portion of this reason. First, aging population. Two, socioeconomic determinants. And third, access to information and healthcare services. There may be others, certainly. And I'm not sure whether any of these factors that I list here are actually explaining all or a part of this risk either. But it's something to think about. Something to think about. As usual, none of this information we share here in this series should be considered as medical advice. Please talk to your healthcare provider. They are the only ones who can give you the best idea about what your risks are, how you can prevent it, which kind of clinical surveillance and or treatment procedures you should follow. They are the only ones that can give you this information for sure. So please consult them. And also I want to add that I'm always looking forward to your feedback. So if you have any questions, comments for me, please reach out to me at savas@man.ca or 709-864-6507. I would be very happy to hear from you. And until then, please take care. I'll see you next time.